Vital signs. This can be found in chapter 13 in your textbook. Temperature, pulse, respirations, and blood pressure. These are all vital signs that are objective. Pain is the fifth vital sign, and it is subjective. We always want to ask the resident what their pain level is on a scale of 0 to 10. And then we need to get some more information. If they're complaining of pain, we need to find out where the pain is, when the pain started. What does the pain feel like? How long has it been going on? Does something make it better or worse? And these are things that we report back to the nurse. There are many reasons that we take vital signs. First, we're looking for signs of illness. So if somebody has a urinary tract infection, one of the first things that we might see is an elevated temperature. Potential health problems, maybe their heart is not pumping effectively and their blood pressure is going up because they have too much fluid on board. Or maybe they have high blood pressure or hypertension, and we're seeing that through repeated elevated blood pressure readings. Or it can be a response to treatment. So the nurse gave Tylenol, and we're going to check the temperature again in an hour and see if the Tylenol worked. We want to make sure we never guess on vital signs. This can be very dangerous for our residents, and we can lose our job. Make sure you report abnormal vital signs to the nurse immediately. This is not something we just write down on a sheet and ignore. It's not something we wait till the end of the shift. It's important to know the normal vital sign ranges, and this can be found in your textbook on page 224. If you don't know what's normal, how can you know what's abnormal? This is really, really important. I don't know how many times I have seen students not recognize abnormal readings. And this can be very dangerous. So make sure you know those normals. Hypothermia. Sometimes this hypothermia and afebrile are misunderstood. So afebrile means lack of or without a temperature. So that's just somebody with a normal temperature within a normal range. Hypothermia is when the body temperature is below the level required for normal functioning. So a person with hypothermia may have pale or blue skin. They may be shivering, confused, quick, shallow breathing, numbness, slow movement, things of that nature. If you go in and check somebody's temperature and you get 95, don't just write that down. Obviously, if you know your normal ranges, you should know that is a hypothermic reading. Now, if they're not cold to touch, it's possible they have just taken a drink or you didn't have good placement of the thermometer. So you need to remeasure that and not just report it or write it down. Use common sense, apply knowledge that you have when it comes to measuring vital signs. Fever is an increase in the body temperature that's above the normal range, and this can indicate illness or infection. Symptoms when somebody has a fever can include fatigue, which is extreme, exhaustion, headaches, chills, muscle aches, or warm, flushed skin. Make sure you report a fever to the nurse. So there are main sites for taking a temperature. We know that oral, which is the mouth, is the most common site. Rectal is the most accurate site. And axillary, that's under the arm, is the least accurate. Tympanic is in the ear, and then there's one other one that's not listed on the slide, and that's temporal, and that's across the forehead. So many of my students will confuse tympanic and temporal. When you think tympanic membrane. So that's like with the ear. That's something found within the ear. Temporal is the forehead. So if you think temporal artery and it's going to cross over that, that's the forehead. Don't let those trip you up. There are many different types of thermometers. There's a glass mercury-free thermometer. They used to have mercury in them, which was dangerous, especially if the thermometer broken, but They're not made with mercury anymore. There's digital, like what you can buy at Walgreens, where you have the little battery in it and you press the button. There's electronic, that's what we use in class and use in the clinical setting. Disposable, that's great for isolation rooms or in first aid kits. Tympanic, like we said, that's the ear, and temporal artery, which is across the forehead. Okay, it's good to know Fahrenheit and Celsius. These are two different scales that are used to measure temperature. Most commonly used in the US is Fahrenheit. Here's a question for you. Does red or blue color coding on a thermometer matter? Yes, it does. Red is rectal, so you should think danger, warning. We don't want to put a red probe in somebody's mouth. And blue or green can be used for oral. So when we're doing the oral site for a patient or a resident, we need to consider a few things of when we don't want to use that as an option. If they're unconscious, if they are using oxygen, if they're confused, if they've having seizures, if they have an injury to the face or an NG tube, nasogastric tube, or if they're younger than 6 years old. These are times we would not want to use the oral site. And then if they are eating or drinking, smoking, chewing gum, or exercising, you would want to wait 10 or 20 minutes before taking the temperature because this can alter their temperature.